My blessing, make I enter this flexing. Me, I no look person, no stressing.
Okay, well, good evening, everyone, and welcome to the third edition of the Century Talk Show. And with Dr. Augustine, our Crown Diamonds, Chris and Tammy, and myself, Kelly Ronson, who I'll be hosting out of Canada. So tonight we've got a very important topic. And Dr. Augustine was asked to speak on many topics, and this week he was asked to speak on chronic kidney disease. And this is for a very, very good reason, because many of us are seeing an increase in this particular disease. And statistically, 1 out of 10 people in this world are experiencing and being affected by this chronic kidney disease. And even on the flyer mentioning, that's 10% of the population. And there's a projection that by 2040, that kidney disease is going to be the 5th leading cause of death in the world. And that's very, very significant. And it's so important that there is now a World Kidney Day that is dedicated for the awareness of this particular disease. And that is going to be on March 10th on 2022 of this year. So how we're going to roll through this presentation is that we're going to have the discussion. Dr. Augustine is certainly going to be talking about some of the causes, maybe the habits that we aren't even aware of that's affecting our kidneys, some of the symptoms, the treatments, and even the advanced treatments that are very expensive, like dialysis, and worst case scenario being a donor. But the most important thing we want to get out of this talk show tonight is about the prevention. And so we'll go throughout the presentation. Chris and Tammy will talk also on that line about prevention and our great products. And then I'll facilitate a question and answer period. So most of us know Dr. Augustine, but if you do not, and you're new to this talk show, Dr. Augustine is the medical director for the Armstrong Hospital in Nigeria. He's dedicated most of his life to helping people. He's supervised many of the outreaches in Nigeria. He's on a mission to help everyone with their health, try and be that preventative, not even, on the other side of the diseases. He's a wonderful man. He's been with our company for many years. He speaks from his soul. He has a wonderful spirit. We're so honored and pleased to have share his information to help us with our health basis. So without further ado, welcome, Dr. Augustine. The floor is now yours.
Oh, thank you very much, Kelly. That was a very wonderful introduction. And thank you, everyone, for joining us this evening. Before I proceed, I would like to reaffirm that you can hear me very clearly. So if that's the case, I would like you to type a Y if you can hear me, so that I can be sure that we are communicating. Okay? Thank you very much. I also want to thank Chris for hosting us tonight, for making this meeting possible. As you have heard, I'm Dr. Austin Oseke. I'm a family physician, and I'm so excited this evening presenting this topic, kidney disease. But before I proceed also, I want to thank you, the participants, for making time out for this meeting. We're going to be discussing kidney diseases. I would say before now, the topic we intended to discuss today was prostate problems. But by popular votes and all that, we chose kidney disease. And I suggested it because just 2 weeks ago, a child was brought to my facility, to the hospital. And this child will surprise you to be less than 1 year old. At the time of presentation, this child could not make urine, has not been making urine for about 2 days. And I told myself, this is one of it. In the past, the incidence of kidney failure is used to be very rare. in my practice, well, when I started practice, maybe we see cases of kidney failures, renal failures, about maybe 1 or 2 in 3-6 months, sometimes 1 year. But now it's almost an everyday thing. So without much ado, I want us to kickstart as we discuss this kidney diseases. Okay, first and foremost, it will be nice for us to go through what the kidney looks like. You can see the slide here. You can see the 2 kidneys. We have the one on the right and the one on the left. It looks like bean. It's a bean-shaped organ. And connected to the kidneys are 2 tubes called ureters. The ureter connects the 2 kidneys to the bladder, where after urine is attained a particular quantity, the stimulus for urination is let off, and the bladder empties. And when you see on the left kidney that is cut open, you could see blood vessels, the artery, and the veins. The ones in green are the veins, while the ones red are the artery. So what kidney does essentially is to filter the blood. The artery takes the blood to the vein, to the kidneys, and the kidney filters the blood. So the filtered blood goes back through the veins, and what is filtered is called urine. The product of the filtrate is urine, and the urine passes this tube down to the bladder. So having said that, what are the functions of the kidneys? It's quite important that we know that. One of the most complex organs of the body is the kidneys, and about 1/4 of the blood supply to the entire blood goes to the kidney. That's to tell you how important it is and how important the functions of the kidneys are. The kidneys purify the blood by getting rid of waste products and forming urine in the process, like I explained earlier. Of course, it is responsible for fluid and electrolytes and acid-base balance. What do we mean by that? It's not uncommon sight to see someone with kidney problems having swollen legs, swollen face, tummy, and all that. That's to tell you that the fluid management of the system is down once the kidney is down. And that's the reason why they tell you those who have kidney problems should be careful about taking water. We're going to discuss more on that. Of course, the kidneys are responsible for drug clearance. When you take drugs, you know, the kidneys and the liver are the 2 organs that are responsible for metabolizing the drugs and eventually getting them out of the system after they have finished their function. We also have other functions which include hormonal functions. And the hormonal functions are basically 2. The kidney secretes some hormones that are responsible for maintaining our blood level. And that's why people with chronic kidney problems usually have low levels of blood and may require frequent blood transfusion. The other function is vitamin D. I hope you can hear me. The other function is vitamin D. And this is even more important in women, especially when they become menopausal, because naturally they tend to have the calcium in their bones wear out or get washed out, and they suffer what we call osteoporosis. Finally, the last function of the kidney we'd like to talk about tonight is blood pressure maintenance. Now, having said that, it is important to understand how the kidney functions. What you can see right now is called the nephron. And we have about 1 million of this structure you are seeing in each kidneys. In other words, putting the 2 kidneys together, we have about 2 million of this. So we have 1 million of this on the right kidney and 1 million on the left. And each of them, has a blood vessel that we call arterial. And you can see this cup-shaped, we call it Bowman capsule. When blood gets to this Bowman capsule, there's a kind of process that takes place here, whereby the water within the blood, gets out into this Bowman capsule, because the environment within this Bowman capsule is such that it's highly osmotic and can pull out water. And as you can see, the Bowman capsule goes, in zigzag position, and vessel still goes around the structure to get the water back into the blood. This is a complex mechanism I want to spare you from. But it's just important to know that this is the smallest unit of the function of the kidney. And as you can see, while the end product of the filtration that takes place within the kidney, is urine. And this flows out to what we call the pelvis, eventually to the ureters, and finally to the bladder. Okay? So now, the next question we want to ask is, what are the signs and symptoms of kidney disease? How do we know somebody has kidney problems? The first thing is there are no symptoms. There are no symptoms at all. That means when kidney problems start, you're not likely to even notice anything. That is why frequent investigation is quite necessary. Like for me, I make it compulsory that every year I do general checkup. I check my kidneys, I check my liver, I check my blood, I check everything about my system every year. Because when this problem starts, usually you can only have the signs, and the signs can be detected when you run investigation. But for the symptoms are the manifestations, physical manifestations that an individual will observe before they know that something is wrong somewhere. So as it is, as you can see here, the first sign is that there are no signs. In other words, no pains, nothing, except if you run a test, probably urine test or blood test, as we get to see later in the presentation. Then the next presentation you may have is pain. And where do we have the pain? Mostly around the back. The kidneys are seated right within the abdomen. If you can conceptualize or visualize the rib cage, that is that bone cage that houses your lungs. If you can press your bone cage that houses your lung and press it towards your back, at the point where it ends, somewhere behind, that's where the kidneys are seated. So most times you feel pains around those areas. It could be the right or the left. So, and sometimes it could be both sides. But there is a trick the system plays on pains. Wherever you have, two pains in the body, the one that is most severe is usually the one that is felt. We call it some kind of maxing effect of differential pain manifestation. So it is only when the strongest pain is gone, you can now have access to appreciate the lower pain. One example that you can all relate with is a situation where you have a very noisy background. Maybe you are at the meeting and you're at a party where there is loud music. You notice that your voice has to come up before somebody can hear you. But let's assume the music just stops suddenly. You realize that you are shouting, above your, quite over your voice. So such situation or scenario plays with things in our system. So the other thing you could also present with is swelling. And what's the nature of the swelling? The swelling of the feet, the legs are swelling, and the swelling, as the disease progresses, the swelling rises gradually from the feet up to the knees, from the knees to the thighs, from the thighs to the waist. Then from the waist, it gets to the abdomen. By the time it gets to the abdomen, at this point, you may actually start having water collected within the abdomen. And if scan is done at this point, you may actually find water in the abdomen. Another sign is this, blood in the urine. If it is macroscopic kind of blood, you can actually see redness of the urine. But in the case of microscopic, in other words, you cannot physically see the urine red. But when tests are run, the test will show you there are some levels of blood in the urine, but just too low. So both of them are significant. Of course, if you can appreciate the redness of your urine that is coming from red from blood, that means the problem is quite advanced, okay? Then you may also notice reduced urine output. And what do I mean by this? If usually you urinate about 4 times in a day or 5 times, it may reduce to 1 or 2 times in a day. And of course, you may have to take much water before you see yourself passing urine, significantly. So that is one sign that there might be a problem with the kidneys. The other thing that may be noticed with someone with kidney problem is fruitiness of the urine. After voiding, you just notice that the urine looks, not so clear, as if some kind of powder have been poured into it. Sometimes it could even froth. In other words, it foams. You actually see it like foam. You may notice this when you probably have taken too much of proteinaceous meals, like too much of meat and all that, and you have plenty of protein in the urine. You may experience this fruitiness. So having said that, how do we then detect the problems of the kidneys? They are just tests that can be done. And what are those tests? We have urine tests, we have blood tests, we have imaging studies, we also have biopsies. When we talk of the urine tests, there are 2 common tests that can be done with the urine. One of them is called urinalysis. Urinalysis is a kind of examination of the urine with the help of microscope and also with the use of strip. The microscope will detect if there are elements within the urine. Sometimes you could find stones, crystals, that are quite tiny. Microscope will help you with that. And if there are cells that are being shed by the kidney or the bladder, you may notice that in the urine. Furthermore, when you use the strip tells you the chemical composition of the urine. Urine could also give an insight to what is going on with your liver. For instance, if you find bilirubin, so much bilirubin, urobilinogen, and all that in the urine, it tells that there might be issues with the liver. So a lot of times, urinalysis is a very cheap test. We use it as the small window to peep into one's kidneys or liver. Of course, if you are diabetic and you have high blood sugar levels, we may see blood and sugar spilling into the urine. So you may find a lot of sugar in the urine. That strip will reveal it. And of course, if there are some bleeding taking place or infection and all that, the urinalysis may reveal leukocytes present in the urine. It may also reveal some cells, in the urine. Then we can also do blood tests to detect if there are urine problems. And what are those blood tests? Most of the time, we do renal function tests. We call it urea electrolyte and creatinine, EU and C. If you are familiar with going to lab for tests, you may have come across EU and C or urea electrolyte urea and creatinine. Creatinine is what we usually use to determine if there is a chronic kidney condition or not. Of course, there are imaging studies that can be done And what are these imaging studies? We can have X-ray, we can have an abdominal scan. Most of the time it's total abdominal scan, both kidneys are checked. We can also have CT scan or MRI to further investigate the extent of the kidney problems, especially where you're suspecting malignancies and all that. You may need to do biopsy. Biopsy is a process whereby a small chunk of the kidney is taken with the use of a true-cut needle. This needle has a kind of hole, a big hole within it. So passing it through the tissue makes you able to harvest part of the tissue, and that can be analyzed at the lab. So having said that, it is important to differentiate the two major categories of kidney problems. We can have acute, we can also have chronic. What do we mean by acute? Acute is what is sudden, something that just, a problem that is occurring and has not lasted more than a few days. And it can usually be very dramatic, severe pains, serious discomfort. They could be running of temperatures and all that, even vomiting. So that is an acute situation. A common acute presentation of kidney problem is what we call pyelonephritis. We may also have nephritis. All these are conditions of infections of the kidney. Then we may also have chronic. Sometimes acute conditions end up becoming chronic when they don't totally resolve. We can also have chronic condition without acute presentation. In other words, the kidneys are already getting damaged gradually, but there are no presentation, and you're already counting months and even years before finally getting to know that, oh, something is wrong with the kidney. So this kind of presentations fall under chronic kidney injuries. Okay, so having said that, we need to define chronic kidney disease. Of course, we mentioned is a matter of time. So this is how it is determined. When kidney damage has taken place for more than 3 months, usually defined by structural or functional abnormalities, as I've mentioned earlier, like the blood in the urine, the swelling and all that, with or without decreased glomerular filtration rates. Of course, we talked of the test that we do to determine, how well the kidney is functioning. And that is what we call GFR, usually manifested by pathologic abnormalities. Let me spare you, because this is not for the regular medical doctors I'm doing this presentation. So of course, the markers of kidney damage include abnormalities in composition of urine, as I mentioned, from urinalysis and all that. The composition of blood, you could have high levels of creatinine, high levels of urea. Then imaging tests. The test you do, like scan, can reveal features of nephritis, features of pyelonephritis, even hydronephrosis. That's a situation whereby there is a back pressure on the kidney, and you begin to see deterioration of the structure of the kidney. Okay, and when we go by the GFR test, less than 60 ml per minute and all that tells you that we are dealing with chronic kidney damage. So, having said that, we need to stage the different stages of kidney problems. I'm not going to dwell on this, because this is especially for the nephrologists, those consultants that take care of kidney problems, especially when they become very severe and beyond primary care. Okay, there are 5 stages. We have the stage 1, stage 2, up to stage 5. Usually dialysis is considered, from stage 5. That's when the GFR is less than, let's say, 15, stage 4 to stage 5. There are other conditions that may determine whether you want to start dialysis for this patient, or you also want to consider what we call renal transplant. That's kidney transplant. So we don't want to dwell so much on this.
Dr.
Okay.
Austin, so I didn't mean to interrupt. I noticed you have some slides to present. I'm not sure if we're supposed to see some slides as you are sharing some of the examples. I just want to let you know that the slide we're watching right now is the initial slide, Century Talk Show. That's the one we've been watching since we started.
Wow, that's serious. There are slides that is.
I didn't want to interrupt you, but it's just I felt it was important for me to mention that. So I see your screen, but we don't see your slides.
That's serious. How do we do it now? Do I stop sharing and connect again? I just stopped sharing now. I'll connect again. Okay. I hope it's going to come on.
Yeah, try to share again.
Yes, I'll try and share again.
Because I did see your screen. And on your end, the screen was not changing.
Can you see the screen now?
Right now it says, yes, I can see the screen. Now, if you want to go ahead.
You can see high blood pressure, right? Please, what can you see on the screen?
Right now, I see the Century Talk Show, 3rd edition, kidney disease.
No.
So why don't you click, the little icon just beside the 59%, click that icon on your computer. That will get you into presentation mode. Right on the bottom of your screen.
On the presentation mode.
It's possible.
Please, serious. Please, sorry for. From here, it's telling me the screen is being shared.
Yeah, the screen is being shared, but the actual PowerPoint itself needs to be executed. So there's some icons at the bottom of your screen. You see like 4 little squares. There you go. Now I see. Now we see problem of chronic disease, chronic kidney disease.
Okay, good. Oh my goodness. I've been sharing this all along.
Well, we've been following, but unfortunately there was no slides.
Okay, so sorry about that. So I'm going to run through this. I discussed this, the true kidneys. Can you say this now?
Yes, very clearly.
Okay, good. I discussed the 2 kidneys, the one on the left and the right, how urine through the ureters get to the bladder and then passed out. Okay. Then I talked about the functions of the kidneys. Can you see that?
Yes.
Okay. I talked about that. It's one of the most common and complex organ of the body. Of course, purifies the blood by getting rid of waste products and forming urine in the process. Of course, fluid and electrolytes and acid balance, drug clearance, hormonal functions, which include, and these 2 hormones are vitamin D, and there's this, we call it an erythropoietin. It's released by the kidneys. So anyone with chronic kidney condition usually has low levels of erythropoietin. So they find it very difficult to maintain normal levels of blood cells. So they may require blood transfusion or a replacement, a substitute for the hormone. Of course, very important in blood pressure management. So sorry about the fact that the screen wasn't sharing. Of course, I talked about Nephron, and this is what the Nephron looks like. We have about 1 million of these on each kidney. So them function in filtering the blood. And as you can see, this capsule-like structure, we call it Bowman's capsule. That is where the filtration takes place. And as the water from the blood gets into, we call it plasma anyway, as the filtrate from the blood gets into this capsule, it gets channeled through this tubular structure And in the process, so many dynamic activities are taking place, maintaining the fluid levels and the electrolytes, so that at the end of the day, we have reconcentration of the urine and it is collected here. So, of course, I talked about symptoms of kidney problems, which include, number one, no symptoms. In other words, you do not notice anything at all. Then we also talked about back pain, swelling of the legs and up to the body. There are times when in the morning you lie down, and when you wake up in the morning, you find out your face is swollen. But as you go about your activities during the day, the swelling goes down. That's a sign of kidney problems, not two other ways. Then we have blood in the urine. Like I said, there are two levels of blood presentation in the urine. You could have a level where the eyes cannot see. You still see the urine as normal color, but then when you test it with the strips, there are some blood in the urine. So you can also see it physically where you have complete redness of the urine. That's to tell you it's an advanced stage. You also have reduced urine output, where the quantity of urine you pass out has really dropped significantly and can eventually, get to low levels. Remember when I opened started the discussion, I mentioned a year-old that was brought to the facility about 2 weeks ago that had not been making urine for about 2 days. It was an unfortunate situation. That child may not survive it, because how do you do kidney transplant for a child of a year-old child? Of course, we talk about fruitiness of the urine, and that reflects the presence of protein on some elements within the urine. Usually when you experience that, it might be a signal that there is a problem within the kidneys. Because there are tests that can be done, like I mentioned, urine tests, blood tests, imaging, and biopsy. If you remember, I defined what the acute and chronic kidney presentations are. Of course, like I said, kidney damage for more than 3 months, usually defined by structural or functional abnormalities of the kidneys. There can be decreased GFR or not, okay? Usually manifested by pathologic abnormalities. I don't want to bore you with this. This will be too technical for you. I also mentioned the 5 stages. This is the least stage, that is the most the early stage where you have the least kidney damage is called stage 1, and where you have the most damage is called stage 5. Usually the GFR, which means the rate at which the kidneys are actually filtering the toxins out of the system and all the necessary things. Once the rate that we actually expect should be above 90, but that shows that the problem is serious. And usually at stage 4 or 5, decision is made whether to do renal transplant or to start dialysis. Okay, so here is where we got to before. Please feel free to interrupt me in case we have issues, because I intend presenting all the slides for this presentation so that we can follow very well and understand. The reason why I did that was because someone was trying to explain what I presented on fibroid, and it was very clear that the person really didn't understand some of the explanation I was doing when I was describing the location of fibroid. Okay, so now, things that damage the kidneys, and this is where we really begin to touch on what matters. And from henceforth, I want you to listen very, very attentively, because this is the main point this is the area we should take very, very seriously, because today a lot of people are suffering and they do not know why. They're suffering from kidney problems and they do not know why. This is the standard presentation by a regular medical practitioner. In other words, this is what curriculum teaches. Okay, I'll go in that order. But where I have some concerns, I'm going to make it known to you. Number one, high blood pressure damages the kidneys. But it may interest you to know that a lot of people have high blood pressure, but it didn't just come to them without having had some levels of kidney damage. I don't want to sound too technical here, but here is what I mean. Let us go down to about the seventh item. You see infections. I would have loved infection to have topped the list. Why so? Is because they say experience is the best teacher, right? In my practice, I've attended to a lot of people with high blood pressure who manifested with features of kidney infections. And after treating them, their blood pressure normalized. What do I mean by this? A lot of my patients that ordinarily would have been blood pressure, been regularly attending, hypertension clinic, they don't. Why? Because what could have affected their kidneys that have led to high blood pressure permanently have been taken care of. So this is a big secret that I'm letting out here, and I want you to really take note of that. So the other thing that does damage the kidneys is diabetes. And diabetes doesn't just damage the kidneys alone. We have also damage of the eyes, the retina of the eye, leading to blindness. I've seen that in my practice several times. We also have damage to the nerves. So there are three basic nephropathies caused by diabetes. There are three basic damages caused by diabetes. D, caused by D, damages caused by diabetes. Now, these three basic damages, number one, we have diabetic nephropathy, which is relevant to the topic of our discussion tonight. There are two other parties that are caused by diabetes. They're out of our discussion tonight, but I should just mention them for completeness. We have diabetic retinopathy. The retina is that film that is in the eyes that enables us to see. So once it is damaged, blindness can ensue. Then we also have diabetic neuropathy. With diabetic neuropathy, people have some kind of problems with their nerves, their extremities. A lot of times you see people say they feel like blood is not flowing through their legs, or maybe they sit for too long and it appears the blood supply has been cut short, okay? And part of nerve damage in diabetes also affects the stomach. The nerve connections that enables the stomach function properly, does not, the connections are affected by diabetes. So you find out that those who have diabetes have problems with digestion. They eat and their foods don't digest. And before you know it, they have things like reflux esophagitis. In other words, what they eat in their stomach after lying down tends to come back to their throat and all that. So we also have a polycystic kidney disease. Polycystic kidney disease is a condition where you have cysts. It's like sacs or balls containing fluid within the kidneys. Sometimes it could be, singular. Sometimes it could be multiple. Where it is multiple, that's what we call polycystic kidney disease. We have the adults, which is usually inheritable. You can inherit it, the problem from from one's parents. We also have drugs and medications. A lot of drugs and medications damage the kidneys, okay? And this may interest you. Some of the drugs that we take, we expect that they are to help us get better. And how do you know this? Number one, before some medications are taken, you are expected to run kidney function test. Where the kidney function test is below normal, it could be a no to that drug. This implies that when you have very low kidney function levels, in other words, serious damage to the kidneys, and you take such drugs, those drugs can eventually destroy the kidneys completely and render a situation whereby you can call an end-stage kidney disease, okay? And that's the reason why they run some tests for you to know whether to start some drugs or not. So in addition to that, it is important to know that drugs are not prescribed indefinitely. What I mean by this is prescriptions are always given maybe for a week, 3 days, 5 days, and sometimes, if most times when you see drugs prescribed for like 3 days, 5 days, and all that, just know that when you continue to take that drug, okay, it's going to damage your kidneys, your liver, or something in your system, okay? That's the main reason. And one of those drugs include anti-malarials, include some antibiotics and all that. And there is this commonly abused drugs because people a lot of times complain of ulcer. They say they have ulcer and that ulcer is not going. And it appears they are permanently on ulcer medications. Such people end up with kidney problems at the end of the day. We have seen that happen. So also those who stress a lot, maybe their businesses entails a lot of hard work, and by the time they are done for the day, they are so tired, and they are usually addicted to taking painkillers. And these painkillers they take is not just paracetamol. You see them take ibuprofen, diclofenac, and all varieties of painkillers. As if that's paracetamol, very high chances of kidneys. Fortunately, all those to the kidneys, it causes you to be very, very careful while you take, painkillers. For me, in my practice, people painkillers is
Oh, I believe we lost Dr. Austin, so just bear with me for a minute. He's going to come right back, and you can continue from where you left off. Oh, here we are.
Yeah, I'm back.
Yeah, just share your screen again, and you can continue from where you left off.
Okay. It's all right. I'm sorry about that. I think it's my connection here.
Don't worry about it. The information is really good. Don't forget to share to activate the slideshow. Yeah.
Please, can you see it?
Right now we see your main Century. Right now we see the Century Talk Show.
Definitely. That's not it. Okay.
So whatever you did earlier to initiate, yes. Okay.
Can you see it now?
Yes.
Okay, there are various screens there and they're all about the same slide. So I guess there's the one that is recognized by Zoom. So
yes.
You can see high blood pressure, right?
Yes.
Okay, good.
Things that damage the kidneys. Yes. Okay.
Sorry. Okay, things that damage the kidney, that's where we were, okay? Okay, now I was talking about medications. Now, when you talk of medication, I think I've explained enough about that. So the next thing is smoking and alcohol. One really need to cut down on them because they do destroy the kidneys, especially smoking. Of course, heart problems, wherever you have heart problem, just know that there's going to be problem with the kidneys. Why is it so? The kidney does not manage blood supply. Like I said earlier, 25% of the entire blood supply to the body goes to the kidneys. You can see how small the two kidneys are, and to imagine that 25% of the entire blood supply goes to the kidneys, while the remaining 75 are shared by other parts of the body. That's to tell you how important, kidneys are. And wherever you have heart problems, it means blood supply is reduced. And that is the relationship, that's the connection with kidney problems. So you should note that. Then, like I mentioned earlier, infection is playing a role that experts are not really aware of. In my practice, I've solved so many huge problems, including diabetes. It will surprise you that somebody comes to the hospital and has features of florid diabetes, blood sugars very high, and you think they have diabetes. But lo and behold, they have a form of infection called pancreatitis. When infection gets to a level and it gets to the pancreas, the pancreas being infected loses its function and is not able to maintain blood sugar level. The person can actually present with diabetes, okay? So infection plays a lot of roles. There are other immune problems, diet, and cancer. Let me talk about diet here. Most times, professionals don't talk about diet when it comes to things that damage the kidneys. But I take it very seriously because I've seen a lot of people whom diet destroy their kidneys. And when I say diet, I'm referring to majorly these social drinks, like soft drinks that contain sugar. There was a time in Ghana, their custom confiscated hundreds of bags of sugar. And they tested either their custom or their NAFDAC, okay? They tested those sugars and they contained mercury. Mercury is a poison to the kidney, a serious poison. So diet is something we should take seriously. Of course, with a diet that is rich in salt and all that, definitely, you could be having some impact on your kidneys. So having said that, it's important we talk about problems of chronic kidney disease. The problems, I think I adduced to some of them earlier: anemia and iron deficiency. Erythropoietin is a hormone that is released by the kidney. When you have chronic kidney condition, just rest assured that all the functions of the kidneys are subnormal. And part of the function of the release of erythropoietin will be low. So for that reason, you cannot maintain good blood level. And if it gets so serious, you may require blood transfusion at various intervals. Then we also have bones and mineral diseases, weakness of the bones because vitamin D is low with kidney disease. Then you can also have malnutrition. What do we mean by malnutrition? There are electrolytes and minerals that are managed by the kidneys. The moment the kidney cannot absorb all those, remember I talked about the kidneys filtering the blood, okay? And it filters the blood, and what goes out, in the process of going out, the blood vessels have a way of reclaiming a lot of nutrients back from the filtered water from the blood. So where the kidney is not functioning well, most of all these nutrients are washed out they are wasted. So you take a lot of vitamins and electrolytes, and they're all wasted, and you come down with a malnutrition. We also have acidosis, electrolyte problems. We also have a cardiovascular disease and all that, like I mentioned, heart problems. Then hypertension also is one to consider, and it's quite important because most patients that have kidney problems tend to have high blood pressure. There is a pathway we call renin-angiotensin pathway. What is this pathway? What's this pathway about? When you have kidney disease, okay, there is a dysfunction in the kidneys generally, and that dysfunction affects its blood supply. And once the blood supply to the kidney is low, what do you then? What the brain? There are some signals that are sent to the brain, and it's like the kidneys are crying to the brain that, brain, I'm not getting enough, we're not getting enough blood here. So the brain releases renin, and it goes through some processes that will now lead to retention of salt, okay? Everything that will make the blood to increase, you understand? So that the kidney can get enough supply. But this is fictitious because this lack of blood supply is not real. So any process that the brain is instituting to increase the blood supply to the kidney automatically translates to high blood pressure. And that is the relationship with hypertension. I hope that's not too technical for you to understand. Okay, so having said that, we want to talk about the processes we go through while taking care of patients. I want to skip these slides, not to bother you with our technicalities, but all encompasses all the things I have mentioned earlier. If the blood level is low, what do you do to correct the blood level? The malnutrition, the BP control, what drugs do you take to control the BP? And what drugs you take to take care of the infection, the diabetes, what drugs you take and stage as you get results, acute and chronic. When it becomes chronic, at what point do you think this person requires dialysis? At what point do you think this person requires a renal transplant? Okay, so having said that, the next slide is talking about the management, the things to be to take note of. Okay, I talked about diets. Your diet should actually be low in salt. Okay, then water intake somehow is not an absolute thing. It depends on your situation, and you should relate with your medical doctor how to go about this. Why I'm saying this is because there are situations where you don't compromise your water intake. A lot of people have been wrongly advised to reduce their water intake beyond, below what is normal, okay? Then exercise is quite helpful. Exercise is good for the entire system, the heart and all that. And whatever will help the heart to pump better will also help the kidneys to function well. And that's where we talk about healthy heart. Then alcohol intake should be minimized, even though alcohol is said to contain, especially red wine, is said to contain some elements that are good for the heart. Okay. All right. Then smoking should be cut off. BP and diabetes management, very important. Then medications, what medications do you take in weight? So having said that, I would like to talk about this, and it is quite important, okay? This is very, very important to me. Back those days, managing patients that have kidney problems, we used to go through a lot. Most times when patients come and they have chronic kidney conditions, they end up on dialysis. Some of them end up having renal transplant. And those are the wealthy people or those who are fortunate to have people to assist them. But we have a lot more people who don't have the money for renal dialysis. And we also have people who do not have money for kidney transplant. Even to donate is an issue. Now, there are some things that I found out that has been quite helpful, and it is important to discuss it. And that's why the source of some of these supplements that I used and found great and wonderful results is a source I will always be grateful to, and I cannot do without mentioning them. That's Max International. I joined Max International in 2017, and I can say from 2017, when I began to experiment initially with these wonderful supplements, because as medical doctors, we do not believe that supplements really could help. Of course, there are some herbal supplements. In fact, if you go and check online, there's what we call Chinese herb nephropathy. There are some Chinese herbs that have been known to cause kidney problems, okay? So that makes it, you know, a no thing for experts. But there are some supplements that I found very, very useful in the care of kidney patients. I don't know if this, there is someone who is expected to be joining us this evening. I wouldn't know if she's online. If she's in this meeting, she can indicate if she would like to share her testimony with us about her brother. I'll not mention her name. The brother, since 2019, has been suffering from kidney problems. The condition is actually nephrotic syndrome. And he's been to several hospitals, private hospitals, general hospital, Lasut, Luth, and all that. And he was dying, not until he came to my facility. When he came, and I told him, well, there are things we could do that could help him, but I'm not giving guarantee. It's worth trying because I've used it for a lot of patients with kidney problems, and I found amazing results with them. So they could try it. Of course, part of the products of the company mixed with some other products were put together. It will surprise you that the parents of this person I'm talking about thought they had met a 419 doctor. So they had to go behind, get an elderly man, an intelligent man, to come and investigate me because of the cost involved in the care. And besides, they claim that an attempt could be made to help somebody who for the past 2 years have been managed by the best health facility in the state, and they're not getting results. And they came and they were asking questions, and they said this is what they had, that I could actually handle this condition and he'll be fine. So I quickly stopped them to caution them. I told them, please hold on. I'm not giving any guarantees here, okay? I've never managed nephrotic syndrome with this line of supplements. But I'm counting on the experiences I've had with people with almost untreatable conditions of the kidneys, and they got better. So I'm only suggesting that they can use it for him. And I feel very sure that he will get better, but no guarantees. You know, when I spoke like that, they felt relieved and they saw the sincerity in my speech. And the next thing, they made payment and got a pack. Lo and behold, in fact, I just wish this lady is here to give this testimony, an amazing testimony. Longevity was part of what was given with other special, you know, I'll call it drug supplement stuff, you know, and lo and behold, he started recovering. And within 2 months, what he was not able to achieve in 2 years, you know, he achieved it. And this is the reason why I will always be grateful to Max International, because the line of products they have helped me to touch so many people's lives, you know, especially those with chronic kidney problems, chronic liver problems, okay? And it may interest you to know that before I started using all these products, say if I refer, before I refer a patient further to other managements, you know, to take care of, it means the condition is beyond, you know, control. And what I get in about 8 or 9 out of 10 is they eventually died. So because of that, I was so interested in an alternative means. And when I hit this company and some other things I use, and these patients, instead of dying, they are living, it became a gospel that I wish to preach. And we have someone in the company who has been a great personality. He has been someone who has inspired me in so many ways. He has, I don't know how to say this. A lot of times when we get to talk about this, we begin to shed, tears begin to run down our cheeks. But then this is about life, this is about passion. When you see somebody, you know, passionate about helping people. When I first met this person, you know, I felt it's all this business stuff, all this network stuff, all this rubbish. But then getting into it and finding my experiences, I knew this is really, really something that one should take very seriously. And I'm no less grateful to him. He is in the person of Chris Gingras. I'll be inviting him to talk to us about this product, because I can assure you that when you use this product with whatever you are using, let me tell you, I don't know if Dr. Alex is online. Please, if you are online, indicate so that we can have you say some words, because he was the first person who had the testimony of converting someone prepared that was on waiting list for kidney transplant. Okay, he was the first person that had a patient waiting for kidney transplant that used Celgevity, and he was removed from the list for kidney. In fact, the doctor said, this man doesn't have kidney problems. Why are you bothering him? You understand? They gave him clean bill of health. So with having said that, it is my pleasure to help me welcome Chris to tell us more about this line of products. Then we continue.
Thank you, Dr. Austin. Really, really appreciate it. Can you give me a thumbs up if you can hear me, just to confirm? Perfect. Okay. Everybody, if you're able to hear me, just put a Y into the chat section to confirm, because I'm about to share with you what Dr. Austin was referring to. Thank you, Dr. Austin. Okay, so let me just share my screen so you have an idea. And I'm not going to walk you through everything, but enough for you to get an idea of what has been going on and the testimonies that Dr. Austin just talked about. It's happening all over the world. And one of the main reasons for this is, you see, your overall health depends on the health of your individual cells. And that's what it comes down to. And every single cell requires what we call glutathione. And glutathione is such an important compound to be able to see, to be able to actually view, to be able to get the results that Dr. Austin is talking about. And again, this is not some wishful kind of witchcraft potion here. These are Mother Earth elements that are put together to elevate this compound through a precursor, which is called glutathione. I'll touch briefly, which is actually called ribosine, which produces the glutathione into the bloodstream. And what's happening is people say, well, what is glutathione? What is that used for? Well, what's happening here, it is glutathione is the body's natural defense against toxins, pollution, and more. See, when God created us, he was very clever. He gave us what we needed for the body to heal, plain and simple. What's happening is due to excess sugar, salt, bad nutrition, bad habits, substances that we consume. All of these things, unfortunately, has caused a lot of challenges, which are called free radicals in the body. And when you increase the glutathione level into your bloodstream, that's why this gentleman had such an amazing transformation when he started using it. It doesn't heal anything. It doesn't cure anything. It feeds the body the proper nutritional elements so the body knows what to do with. And from there, it boosts that compound called glutathione. And you will find a stronger immune system. It reduces inflammation. You see, when inflammation is high, most likely your glutathione is low. But if you increase your glutathione by consuming supplements, then the inflammation goes down. And the inflammation goes down, your body heals again. It doesn't matter what organs we talked about. You understand? So it's not designed to heal the kidneys or heal the body. It's designed to help your body to be in a better environment to heal itself. It slows down the aging process, promotes energy, enhance sleep. It improves the mental focus. It improves the performance in every aspect in the office and, in your activities, even in a boardroom or even the bedroom. It's really interesting. In fact, we have some really nice stories in Nigeria. So the fact is, as we age, that really important compound called glutathione decreases and decreases and decreases. And it starts at the age of 20. And the reason why I know all of this is because I've been listening to doctors like Dr. Austin for the past almost 16 years of my life. And I've been listening to, in fact, more than that. It's more like 27 years in my life, because it was another company before that was talking about glutathione enhancement. And I came to Max because 15 years ago, because I understand what Max brings to the table. And since then, we've traveled the world. We've seen testimonials happening in Nigeria, exactly the same thing happening in Canada, or happening in the US, or happening in the Philippines, or New Zealand, all over the world. So what's happening is your oxidative stress starts taking a toll on you when you reach the age of 40. And you notice that cross here between 55 and 60? This is when the body starts feeling a little less resilient towards the damage. And that's when you tend to go see your doctor more often. And that's when problem arises. So again, glutathione goes to poor diets, alcohol, drugs, and pollution, which are also associated with over 74 medical conditions. So see, the challenge is to keep the glutathione high. So when Dr. Austin talked about those patients that started consuming it, it didn't heal them with these products. It started feeding the body with nutritional elements that feeds the body with precursors the body needs to heal. And that is that ribosine, which is a US patent. That's the actual number of the patent. This technology is so profound and so significant. It's a solution to a major crisis in our society when it comes to our health. This is the inventor, Dr. Herd Nagasawa. You can do your research on him. It is amazing what you will find. This man has such a CV, it's unbelievable. But 45 years of professorship in medicine, 25 years research, 43 peer-reviewed studies, patents, most advanced glutathione technology in the world today, and it's exclusive to Max International. These are the products, and here's what's really important. It's banned substance control group. It is certified as a drug-free certification, but it goes way beyond that. It's also to confirm that these ingredients in these products are exactly what they say they are designed to do. And because of the different religious, families and communities, that's why we have the halal certification. There's no pork. The capsules are veggie caps, the vegetables. So it's breakthrough products. And I'm not going to talk about all our products, just about 3. This one over here, this is the one that Dr. Austin was talking about. It is called Jubilee. It is the world's most advanced ribosine technology mixed with 12 other ingredients. Aloe extract, resveratrol, which is, by the way, when Dr. Austin talked about the red wine, the extract, which is the skin of the red grapes, well, that's where the property is stored in. That's what the resveratrol is all about. That's what he was talking about. Broccoli seed extract, grape seed extract, turmeric root extract, black pepper, which is really good for the heart. That's why when you take these products, you don't want to drink a coffee with it. You want to drink a full glass of water to make sure it goes through the entire system, right? So it goes through all of the digestive tract and the tubes and everything else. Milk thistle, quercetin, vitamin C, alpha-lipoic acid, selenomethionine. Dr. Austin, you'd be better to pronounce this than I do. And cordyceps. Cordyceps comes from a snail that turns into a mushroom. Really interesting. In the Asian community, it used to be only reserved to the rich and famous and royalty. Now it's available to the entire world through our products. You see? So this here is the product that you really want to be on, this Celgivity. And Dr. Austin can give you a very good indication of where to get this. So the person invited you to come and listen to this can give you an indication of where and how you can get them. The Max ATP, this is also fueled by ribosine. It is designed to sustain peak performance, helps replenish energy and fatigue. If you find you're tired all the time, you will love this product. Neutralize free radicals and antioxidant, and it's oxidative stress that it neutralizes, right? The stress from nerve and excess work and lack of sleep and bad nutrition. Improve recovery after physical exercise. If you train, you take this, you recover a lot faster. If you don't train often and you're having some lactic acid pain when your muscles are hurting, you're going to find that your body will heal very quick. And the last product I want to talk about this evening is the Max Infuse. Because you see, in our food today, the problem is a lot of nutrients and minerals are missing due to the way the cultivator food for fast production and big profits. And also there's the GMO food that's added in there. With this, which is food, is not even grown naturally anymore. It's chemically grown because it's very cheap and it tastes very close to the same, but it doesn't have the same nutrients property that Mother Earth was designed to do that comes from our planet, that comes from our ground. So it contains important direct and indirect antioxidant to supplement what's missing in our basic food. It supplies important vitamins and nutrients, as I said earlier, and support and enhance glutathione functions. So that's all I wanted to talk about when it comes to our flagship product. And I highly, highly, highly recommend for you to take this very seriously because it could really, really change your life. So Dr. Austin, I'm going to turn this over to you, and I want to thank you for giving me an opportunity to share.
Okay, thank you very much, Chris, for that brief introduction of those wonderful products. Like I was saying, sometimes it looks as if when we talk, we just talk based on our personal interest, and probably we are myopic. We do not understand what we are saying. I've been in this business for well over 20 years. And I tell you, there are some conditions right from when we were in school as medical students. There are some conditions we just know they are death sentence. They are death sentence. This one, there are no gainsaying this fact. I want to tell you that a lot of times, it's like a conspiracy when people don't come to tell you that this is the true picture of what is going on. And that's why a lot of times people appreciate the Western culture where they don't mince words. You hear things like doctors telling you, you have 6 months to live, you have these years to live and all that. You can't live beyond 4 years, 5 years, There are conditions like that. Even when they tell you this, that's after all the interventions, okay? After all the interventions, after everything done. In my practice, it used to be a painful experience. At a time, I wasn't a fulfilled person as a medical doctor, because when you see somebody walk up to you, I'll begin to list them to you now. You see, sickle cell. When a sickle cell patient walks up to you as a medical doctor, you just know that it's a problem that has come to you. You don't have solution to that, but you can't just tell the patient, please go away. There is no help for you. You see somebody with arthritis, they've used all the drugs in the world. In fact, everything you have in mind to give them. If you're a medical doctor, I know you can relate with this. You just know what else can you give this person. At the end of the day, there is what we call knee replacement therapy. Okay? Knee replacement therapy. Knee replacement surgery, not therapy, whereby the knees, the joints, knee joints are cut off and a metal, or we call it prosthesis, are put in place, okay, to fix that. I have somebody on this call right now, and I want us to allow her to say one or two things. That's Mrs. Ronke. If you can talk to us about your testimony, because this is somebody who was to pay 2-point-something million naira to have knee replacement therapy. And having this product, you know, with some other things put together, within few months, she was back on her feet, no surgeries. Okay, so how do you now tell me that I should be ashamed of proclaiming this great opportunity to people? Is it liver problems? Kidney is a common thing now, and it's a pandemic that is waiting to happen. Okay, it's a pandemic that is waiting to happen. So, well, if you're on this call, I count you privileged. Okay, you're lucky, and whoever invited you to this call really means well for you. I am a certified medical practitioner. I'm a family physician. I have great trainings, you understand? And I do amazing things. Okay, and I can tell you that one of those things that gave me the leverage is the product of this company. And a lot of us here can bear me witness. So having said this, I want to hand over to Kelly, because we may have some people that may want some clarification about one thing or the other. Okay, and if there are some comments or whatever you have to say, please, over to you, Kelly. Thank you.
Thank you, Dr. Augustine. A really incredible information. Not sure if I followed all of the scientific part. I certainly think it's an incredible, I completely understand the of what you were saying, absolutely. And, you know, I mean, with the supplementation that Chris had gone through, the importance of raising our glutathione, and you having that experience, you know, prevention is absolutely the key. And it's scary to think that this disease is becoming, you know, so common, where the cost even of dialysis, for instance, at the stage 5 as well, between 300 and 400,000 naira a month, you know, which is really scary. So prevention is a very clear message on this webinar tonight with the supplementation that Chris has just covered. So I want to thank you very much for all of the information. And I'd like to open up the webinar to anyone that has any additional questions or wants some clarification on the information that was provided tonight. If you could send your questions through the chat session. Just to know what the question, go through some of the answers. Okay, so if you want to send a question to the chat, please do so. And I'll read that out, and Dr. Augustine can answer the questions for us.
You can use the comment section to type your questions.
Yeah,
and
so I'll
if you
just
wish
put
to
any
say something, you
questions
can raise
that
your
we
hand.
have. Dr. Augustine, I have one. In terms of dialysis, is there any going back from that? I mean, is it possible to take, I've had people question about taking the Celgevity when they're on dialysis. Could you comment to that question?
You see, what I have to say is may sound very crazy. May sound very crazy. I remember a patient who was diabetic, was about having one of his foot amputated. He actually moved from a dialysis center to my facility. In fact, before I could allow him to come, I had to go in there to check him to see what kind of patients they were bringing in. And I want to tell you that this man, the day he stepped my facility, was the last day he did dialysis. No medical doctor will agree with you on this. You understand? It's crazy. It doesn't make sense. But this particular man donated 2 wheelchairs to the hospital for what we did for him. I don't know if you are related with me. Now, yes, when somebody is on dialysis, it depends on the level of the disease, okay? It depends on the level of the disease. And it's also important to know what exactly is causing it. Because it's very unfortunate that a lot of people are undergoing treatments of their kidney conditions. They're undergoing dialysis, and they're already being planned for kidney transplant, and yet they've not been able to lay hand on the nature of the kidney problem. I have seen that over and over. In fact, there is a present case that I was paid to go and see in another state. Why did they pay me to go and see that person? It was through this Celgevity. And one of us here, my brother is here, Taye Oseke is on this team, is on this meeting. He was the one that introduced the lady to me. Her mom had kidney problems, okay? And she was to have kidney transplant. In fact, they were preparing her for kidney transplant. So I asked a question, what is the nature of the kidney problem? All the investigations done did not reflect that they really knew what was going on. I had to tell them what tests to do. When the tests came back, the diagnosis became very clear. And it was such that you don't rush to do transplant for such patients. Otherwise, it's going to fail altogether. So it may interest you that all the consultants that were managing this woman eventually were using the results of the investigation I ordered for, such that when they suggest a particular treatment or drug to them, they always want me to veto it, to oversee it before they go ahead, giving me greater, privilege to manage the case. I don't know if you get what I'm trying to say. This is very, very insane. It's unthinkable. And this is what is going on. So a lot of times, if you can know exactly what the major problem is and you tackle it, like has been rightly said, low levels of glutathione, okay, will cause kidney problems. You can take it anywhere, is a fact. Now, if you do not at least try something that could boost glutathione levels and you go ahead with any form of treatment, just take it. The treatment is going to fail. It's going to fail. No two ways about it. This is what I have seen in my experience. Okay? I don't know if I answered your question.
Yes.
Okay.
Thank you very much. I appreciate that.
You're welcome.
So we've got a couple
some
questions.
Have come in, yeah.
So Olasunde asked, how can one get these products in Nigeria? Definitely the person that brought you to this webinar, reach out to them and they will be able to provide you with that information on how do you get the products. Today's question. Kareem, sickle cell warriors do cells from getting to kidney crisis? Can you answer that, Dr. Augustine?
What can sickle cell warriors do to prevent themselves from getting to kidney crisis? Very, very nice question. It may interest you to say that my first testimony with this product was with a sickle cell patient. Okay, and on that fateful day, the 6th of June, 2017, this lady was to die. Yes, no two words about it. I was setting her lines and it wasn't working. I couldn't access her vein, so I had to refer her, but her parents declined. They wanted her to remain dead or alive in the hospital. And there and then, I remembered this product, Celgevity and Max ATP. So I used both for her, and within 10 to 15 minutes, this sickle cell lady recovered. When I say recovered, it's not just mere recovery. She was supposed to be transfused with blood on that admission. We didn't give her blood because she became stable and her blood began to rise as she started using Celgevity, okay, and other things. So when you ask this question, what can sickle cell warriors do to prevent themselves from getting kidney crisis? The answer is just simple. Take Celgevity, but then it is not a license to look down on other important things. You may want to reach out to me for me to give you further information, because there are a lot of things that are too sensitive, okay, to mention here, okay? They look so raw. So there are some important advice that you will benefit from, okay? If you can find a way of reaching out to me. By the way, this video is being recorded. This meeting is being recorded and is going to be posted. So I would like everyone that is here and whomever you share it with to go and watch the recordings, and you can also post your questions. You can ask anything just in case we are unable to address everything here, okay? And I would like you to also do further, like share, like, subscribe, as they always say, to the channels and all that, so that there can be progress. I hope you understand. So for the sickle cell warriors, please, when you take Celgevity and you observe other necessary things like good water intake and aggressive management of infections. The moment you notice any infection, kidney infection, malaria, whatever it is, manage aggressively, okay? In other words, at the very early stage of presentation, do not waste time, just treat it, and you should be able to avoid, in fact, your kidneys will be better. Like the lady I mentioned in that testimony, since 2017 till date, she has never been admitted. She has never had any cause to come to the hospital. Isn't that an amazing testimony? Thank you.
Thank you, Dr. Augustine. Okay, Ataranke has mentioned, please, what advice would you give someone who's having blood in her urine? She's started using the supplements, but still panicking.
Okay, thank you very much for that question. I think I'm aware of this case, and it's quite unfortunate that I didn't meet this person at a very early stage of the situation. So definitely haven't started Celgevity and still seeing urine in the blood. Definitely, we don't expect an instant resolution, especially when we are dealing with malignant situation, okay? Because it's like the case being talked about is a malignant case, and of course, I think some chemotherapies have been taking and all that. I'm not too sure about that. But for that patient, it's important that the patient stays positive. The patient takes enough water. The patient checks her blood level frequently, and also test for infections and all that. So in a matter of time, in due course, there should be improvement, okay? But I'll tell you, is a case that I would say is more like a terminal case, you know, that we're trying to revive. So I think the patient should be encouraged to stay positive, because when you are not positive, you are panicking and all that, you continue to release some bad chemicals that could further worsen or undermine your health. So that's what I think I can say to that. We can also, you can also see me later for further discussion on that. Thank you.
Okay. Thank you, Dr. Augustine. Okay, so Kareem, in terms of Dr. Augustine's number, if you were connected to this webinar through a person, then we can, I would suggest to reach out to them, and they'll make sure that the contact is made with Dr. Augustine. If that's okay with you, Dr. Augustine.
Please come again, I didn't get that.
Kareem is interested, of course, in getting more your contact information.
Okay, that's all right.
Yeah,
it's okay.
So she can just reach out to the person that invited her to the webinar, and then you can make the connection together, if that's okay with you.
It's okay.
Okay. Okay, do we have any other questions? Very good information, very helpful. Okay, what I would suggest is if you do have, as Dr. Augustine had mentioned, the recording is going to be up in the very near future. So listen to it again to be able to understand a lot of the information he provided. I want to thank you, Dr. Augustine, for your time, your valuable time, your experience, your knowledge in terms of that, and Chris for your the information provided by the supplementation and the techie part of all of it, which is fantastic. So a great leader, both great leaders. So thank you so much for joining us this evening. I hope you have a wonderful evening, and I hope that you got a lot of value out of this session tonight. So thanks again, everyone. Have a wonderful night.
Yeah,
bye for now.
Thank you. Bye.
Have a good
Bye-bye.
night. Thank you. Bye-bye.
Yeah, good night.